Welcome to today's episode of Coffee and Clarity. I'm your host, Sophie Streit. Today we're excited to have Siri Kabrick with us. Siri is a mental health nurse practitioner at the Mayo Clinic. She helps people with their mental health and knows a lot about dealing with anxiety, depression, and substance use. Siri works hard to find the best treatments for her patients, clear up misunderstandings about mental illness, and connect people to helpful resources. She loves helping her patients improve their lives. We're looking forward to learning about Siri's expertise in mental health and substance use. Siri, thanks so much for joining us today. Can you tell us a little bit more about yourself?
You bet. Thank you, Sophie. I am a psychiatric mental health nurse practitioner. I've been working at the Fairmont Mayo Clinic Health System for almost 9 years. And I came to the mental health role kind of by accident. I was a nurse practitioner in the medical world, and a lot of people needed mental health services. So I ended up going back to school so that I could serve that in our community. So I kind of found what I like to do by accident. So, and I see I see all ages, from young children to elderly people, grandmas and grandpas. And I primarily talk a lot about medications with people, but we do a lot of supportive therapy and getting people other services and stuff that they need. So that's about my job.
So in your position, how do you see substance use cross paths with mental health challenges, particularly among young people?
Right. Well, substance use is definitely a problem I see in the work that I do across all ages. And youth is a really critical time to be able to intervene and, best of all, prevent. Prevention is a lot easier for people than having to go back and treat a problem that people have. And with mental health issues, sometimes the mental health problem comes first, that maybe people go to substances to help them cope with the mental health problem. And for others, the mental health problem is a result of using substance use. So I've seen both of that happen. And usually it's a means for people who have maybe an underlying depression, anxiety, or even ADHD type symptoms to help them cope with strong emotions, unpleasant emotions, or the circumstances that they face. So there's a lot of overlap between the two.
Mm-hmm. And can you share some insights into unique mental health struggles that youth face today and how substance use may factor that into these challenges?
Yeah. Well, humans are wired to be connected, to seek connection, to feel safe and secure. And in some cases, youth find that connection by being around other people. And some of those people might use some substances. So sometimes youth can come upon that quite simply by engaging in activities, social activities and things that they find that's a way for them to feel like a sense of belonging and acceptance among their peers, their friends. So that's one main issue, I think, where a lot of kids get exposed to substances because they're around people who use them. And I think that's especially in our post-COVID pandemic world, where there was a lot of isolation for a period of time with a lot of youth during really formative years, times where they're developing a lot of people skills and social connections. And so, you know, we as human beings are wired to be amongst each other, mm-hmm. amongst other people, and having relationships and living in a community. So I think it can be a challenge when people are isolated or in their school setting, if there's difficulty in feeling a sense of belonging in the school. Or, some people have more difficulty making friends or feeling a connection, or maybe have felt ostracized or targeted by bullying and things like that. So feeling a connection and having a peer group that they can connect with, that's a big struggle, I think, for a lot of young people.
Mm-hmm. And how can young people recognize signs of mental health issues in themselves and in their peers?
Right. Well, I think in both looking at ourselves or at looking at their peers, noticing changes, what's usual and what's changed. So if usual level of functioning was getting good grades, participating in school activities like sports or theater or music, and some of those things they're not participating in those as much. That might be a sign to a person, maybe that they're noticing in a friend or a family member that's just a different level of functioning than they were doing before. So that can be a big sign. That can indicate maybe some depression symptoms or anxiety symptoms or something else like some substance use. So the changes in the level of functioning, more isolation, more keeping to themselves, or not being participating in social activities as much as usual. You can also see changes in appearance. People might change how they're taking care of themselves, maybe not taking care of their hygiene as well. Maybe they used to shower, do their hair, do their makeup, and that isn't something that they're doing as much of anymore, or changes in clothing. Just not necessarily style, although sometimes it can be style, but, maybe they used to be a little bit more put together, and maybe they're wearing more in casual clothing, or just a little different than they had been before, and their grooming and things. And also their change in activities that they used to do. Maybe they were more social at the lunch hour, and now they're more by themselves, that kind of thing. Mm-hmm. So when you see people withdraw or change in their kind of daily functioning, those can be warning signs for either noticing it in yourself or noticing in somebody you care about.
What strategies do you recommend for youth to cope with stress and maintain their mental well-being without turning to substances?
Right. Well, I think a good overall healthy lifestyle in general is something we all can probably do a little bit better at. Mm-hmm. Maintaining sleep. Sleep can really get kind of a little different in high school and in middle school and high school, because just naturally adolescents tend to have a little different clock. They tend to stay up a little later just naturally and want to sleep a little bit later. So maintaining sleeping habits, a regular bedtime, regular time to get up. And that can be really challenging these days with all the electronic devices that we have. And those can be great in a lot of ways, our phones and stuff, but they also can kind of get in the way of some of our better habits. And I think we're all a little guilty of that. So definitely sleep is important, and maintaining healthy nutrition, having a balanced diet, eating fruits and vegetables, because they give important nutrients to your brain to help support good mental health. Getting physical exercise, getting activity, and that really helps promote good brain chemicals that I like to call brain fertilizer. When you exercise, you're exposed to the sun. Those are actually very health-producing activities that can really make a chemical difference in a person's brain. Mm-hmm. Being social, being amongst people, they feel like they have a sense of belonging, doing things that they like to do, but also that they can excel at and do well for themselves. And then having goals, having a future to look forward to, having a plan for, maybe school, after school, the future, and that plan can always change, but having a goal at the time, I think, is really important. So,
do you think having healthy relationships and healthy friendships help with that too?
100%. Mm-hmm. Like I kind of said earlier, we're we're communal human beings. We want to be around other people. That's how our ancestors have always lived. People have always depended on their community for daily living, for life. And so having connections with friends and people is really, really important. Yeah. Especially in the adolescence where you're all, in the adolescence, I always say adolescents are learning how to be people on each other.
Yeah.
We're kind of like each other's lab rats. We're experimenting on each other and learning how to be friends, learning how to be contributors to society. But we make a lot of mistakes because we're all kind of learning. So we all have to kind of work through that together. But that's a really important time where you develop social skills that you carry on throughout your whole life. So definitely that's important.
Mm-hmm. And in your experience, what are some effective ways for youth to access mental health support and resources?
Right. And access can be challenging, especially where we live in a rural area where there isn't a service or a therapy office on every corner, right? Mm-hmm. We kind of have to dig a little farther. So for youth, I would say a good place to start is within the school system. Maybe they don't provide all the service, but they can get you connected. Mm-hmm. So using your school counselors, even a trusted teacher, being able to have somebody you can go to say, I'm having some difficulty and I need some help. Because it takes a lot of courage to do that. Yeah. It really does. So connecting with anybody in the school that you feel safe with. And they usually, I think most people who work in a school know kind of the next step to take. So that might be a counselor, it might be the school nurse, might be a teacher. Any of those are good people. And then I know it can be hard to talk to our parents about sensitive things, but hopefully people have a trusted adult or a parent or a guardian or some family member that they can turn to and feel they can be themselves with and ask for help. And that's one of the things we face in society is having that stigma, that opinion of other people, or that society might look at it as kind of a weakness if you are having a mental health problem. And we all have to, by talking about it, we work on decreasing that stigma.
Mm-hmm. Yep. Yeah. How can we combat the stigma surrounding mental health and substance use among young people and create more open and supportive environments for discussion and outreach?
So I think it's important that we support our friends that are not using substances. Because that might be going against the grain in some social groups, that you're the one who's not participating in that kind of activity, or not making it difficult for people to choose not to use substances. So supporting the friends who don't use it, being kind, listening to each other, supporting people where they're at. And just being available when people need to talk. And if you have a friend or somebody close to you that you are suspicious might be using substances or you're concerned about their mental health, it can be hard to speak up. But it's important, I think, that you have the courage to do that. It's not tattletaling when you're expressing concern about somebody else so that they can get maybe the help that they need. Mm-hmm. So it's not a teen's concern about what to do about a problem that their friend is facing, but it can be a person's job to speak up about it and to be a voice for somebody who maybe doesn't feel like they have a voice. Mm-hmm. So, yeah, it takes a lot of courage to ask for help.
Yeah. What role do you think youth-led initiatives can play in promoting mental health awareness and substance use prevention?
I think what the group in Martin County does with the Empower group is a great place to start, because you offer peer support. You offer that, share that there are people who are choosing to live a life of abstinence, and creating culture of abstinence, that it's okay to not be using substances, to not go in that direction, and being a safe place, having safe spaces outside of school, activities that people can go, safe people, safe adults, safe spaces that may be different from home and school.
How can schools and youth organizations better support the mental health needs of their students and members?
I think a role that schools and youth organizations can play is in recognizing where limitations are in people's lives. In the medical world, we call this social determinants of health. So things like housing, poverty, access to food, medical care, transportation, things that make life hard. Recognizing where we can make changes so that life isn't as hard for people, so that they can reach their potential and get their needs met and all of that. So I think that's really important for schools. That's a big role for schools to play. I think in bridging access to things that people need. Yeah, identifying the people who need those things. Yeah.
What are some key messages or interventions that have stuck with young people in your practice when it comes to mental health and substance use awareness?
I think one of the most important things is that teens, youth have a safe person or a safe place. And it only has to be one person that somebody feels that they can be themselves with and be honest with and to be vulnerable with. So I think having a trusted adult, whoever that might be, it might be a parent, it might not, it might be a sibling, it might be a teacher, but somebody that they can trust and be open and vulnerable with, and having a safe space to go.
Yeah. How can parents and caregivers have productive conversations with their children about mental health, especially in a way that's relevant and relatable to the youth?
I think we need to all be able to listen, and listen without judgment, and have an open mind, and recognize that maybe the experience we as adults or parents had is a different experience than what youth are going through now. The world has changed a lot since I was a teenager, and we may not have all the answers that we thought we had. So I think being open and honest and just listening rather than trying to maybe solve the problem, just allow a safe place for people to talk. So that's, I think, one of the most important things that we as adults should be doing, and to learn about the challenges of mental health problems and substance use. I also think being able to get early intervention when there is a problem. The earlier we can get somebody help, the better off down the road they'll be. Not just assuming people can just take care of kicking a habit or something on their own, but actually getting people the help that they need early before it becomes a bigger problem to minimize harm later on. And I think also being an example. If we want other people to avoid substance use and using illicit substances, that we have to be an example to our youth, and not say, oh, that's just something you can do when you're an adult, but be a demonstration of what it's like to live a substance-free life. So I think that's important. That's a role we have as adults.
What are some emerging trends or challenges you've observed in youth mental health and substance use, and how can they be effectively addressed?
That's kind of a big problem. I don't know that I have all the answers for that. I think vaping is definitely a big challenge. For a while there, we thought it was maybe a safer alternative. to some of the other things, and we're learning it's not. It also has a lot of danger associated with it. I wish I had the answers. It's not all my problem to solve, definitely, but how do we maintain minimizing access for people? Or, people find ways to get substances even when they're difficult to get, but making it a little bit more difficult. And it's hard because some of that involves laws and people's right to make their own decisions and that. So, and I think legalizing cannabis has some challenges as well. Regardless of whether it can be helpful for one thing or another, it definitely does make treating mental health a little bit more difficult. I tend to see people who have had not the best experiences with cannabis. And so I've seen kind of the bad stories of when people have complications from using substances. I don't see a lot of the good stories that people claim are out there. So I think those are real big challenges.
What do you think is a good way to make it a little more challenging for youth to get those substances?
Oh, $1 million question. I definitely think and this, in no particular order, I think advertising to youth, making it attractive and acceptable to youth is a problem, because as humans we're very vulnerable to advertisements and peer pressure, and especially youth who are still trying to form their identity and what their values and the things that they stand up for. So I think the advertising is a big influence, and the making it so attractive to youth. I think for vaping, I know they have different flavors and they make it seem kind of like it's more desirable and fun and good, and it isn't. And so I think that's a problem that is on the shoulders of our manufacturers and our corporations that are selling these things to youth. So, yeah.
And looking ahead, what do you see for the future of youth-focused mental health and substance use support? And how can we empower young people to lead the way in creating positive change?
Well, I think that's probably one of the most exciting things, is that probably the first generation, the youth right now are probably the first generation that is growing up with mental health being something that's talked about. Whereas when I was young, that was still quite new. So I think bringing it to the forefront that it is something that we all seem to have in common to some degree. Mental health is a spectrum, and some people, are one end of the spectrum and other people are on another, and that it's on the surface, that we can talk about it. And I think we've got the generation of youth that we have now are going to be change agents in this world. I think it's very optimistic, because the opportunities and the connection with the global society is unlike we've ever had before. And so the ability to disseminate information and for the good world, I think, is very exciting. I think the youth of today are going to really demonstrate leadership in the mental health world, and hopefully will make a change that will be inventive and innovative and really be for the good of society.
That wraps up our conversation with Siri Kabrick. Siri, thank you so much for sharing your knowledge and expertise on mental health and substance use. To our listeners, thank you for joining us on this episode of Coffee and Clarity. Remember, if you or someone you know is struggling with mental health or substance use, don't hesitate to seek help and reach out to resources available.